Welcome. Thank you for joining us today for From Under the Radar to All the Rage, Family Resource Centers and Family Resource Center Networks. I am Robin Shumwell, and I am the Project and Communications Manager for the National Family Support Network, and I will be your presenter for today's webinar. If you're joining us online, you may listen directly through your computer speakers. If you have joined via the phone number that Zoom provided, your line has been muted to minimize background noise. For those of you who are online, please note the link to the Dropbox folder in the chat. For there, you'll be able to see some of the handouts that are available to download. In addition, you may put questions in the question section at any time. The chat section is open for you to include any comments during the webinar, but if you have any questions, we do ask that you add that to the Q&A section of Zoom. If you are having tech issues as well, our live tech support, Felipe, is in the room and he will be here to help you. I'll definitely try to get to all of the questions at the end of the webinar. And if I'm unable to answer one of those, myself or one of my teammates from the NFSN will follow up after the webinar. Today's PowerPoint, the handouts, and a recording of this webinar will be available on the NFSN website under the Webinar Wednesday page by this time tomorrow. When you exit the webinar, an evaluation will automatically appear on your screen. We do ask that you take the time to complete that evaluation as it provides us with valuable feedback to inform future webinars. So for us to get started today, I would love to find out who is in the webinar space with us. So we have a poll popping up here. Let us know which region of the US that you are coming from. If you are joining us from outside of the US, or if you are from an area that is not listed here on this one limited map, let us know in the chat where you're from, where you are joining from. Give a couple more seconds so that folks in the room can answer. I see we've got some folks from Wyoming in the chat coming to us from the West. Let us know here in this poll, and we will take just a couple more seconds. And when we have majority, we'll go ahead and have Felipe close that. And let's see the results. Okay, so we are heavily representing the West Coast today. We have almost 40% of participants from the West Coast, also being joined from my other folks in the Midwest, my fellow Midwesterners from the South, Northeast. Do have a couple of folks from our neighbors to the north in Canada, and some other spots here unidentified. All right, thank you for responding to that. So I'd love to give you an overview of what it is that we are going to do during our time here today. We are going to review family resource centers, review family resource center networks, the NFSN itself, and then I'll go over some of the resources and opportunities that are available to you all from the NFSN. And friendly reminder that my PowerPoint is sharing. Keep an eye on this screen here, and this PowerPoint will be shared with you and be available by this time tomorrow. So I'd love to start by talking about family resource centers and the history here. The concept of family support dates back to the late 1800s with the creation of settlement houses in major metropolitan areas such as New York, Boston, Chicago, and San Francisco. Settlement houses provided the large number of immigrants entering the country at that time with support, job training, English classes, and social advocacy as means to assist them in understanding, adapting to, and succeeding in American society. This slide illustrates the Good Samaritan Settlement House in San Francisco on the left from 1913, and on the right, its modern look as the Good Samaritan Family Resource Center that continues to serve families today. Originally serving immigrants from Europe, Good Samaritan has evolved with the changing community needs and shifts in the neighborhood population into a family resource center serving the Latino community. Mouse has frozen. So, thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as what we like to call America's best kept secret. A family resource center is a community or school based welcoming hub of support, services, and opportunities designed to support families to be strong and successful. They may be community based, like the image on the left of a family resource center in Vermont, or they may be school based, like the image you see on the right from Kentucky. They may be in rural settings, like the image you see on the left from Colorado, or in urban settings, like the image on the right of a family resource center in the Bronx in New York City. Wherever they're based, FRCs work with families with an approach that is not only two generational, but multi generational, strengths based, and family centered. So each of these concepts is important. Have you heard of two generational or two gen work? Well, family support is the original, not just two gen, but multi gen work, as programs work with children, parents, and grandparents as well. They're strengths based because we see families as having strengths that we want to support them to build upon. And they're family centered because everything that we do has families at the center. Family resource centers are designed for all families, not only low income or highly challenged ones. So the support that they provide is non stigmatized, making it readily accessible. Programming is provided at no cost or low cost for participants. The image to the right on your screen is of a family success center in New Jersey. There are 57 family success centers across the state's 21 counties. Each county has at least one, but typically more than one family success center. That includes highly affluent counties as well as highly challenged counties, because again, the belief is that all families could benefit from access to support for two of the most important roles we can have as adults, being parents and being spouses or partners. Two of the most important roles we could have for which we typically receive no support or training. Hence the value of universal access to FRCs. The strengthening family protective factors come from the Center for the Study of Social Policy. And research has shown that these five protective factors increase family stability, enhance child development, and reduce abuse and neglect. So, as we are all working with families, we want to support them to build these protective factors because we know that they can make a positive difference. The protective factors here are parental resilience, social connections, concrete support in times of need, knowledge of parenting and child development, and the social and emotional competence of children. The CSSP website that you see here on the screen that's linked is where you can go to learn more about the Strengthening Families Protective Factors. Although there is no dedicated federal funding for FRCs, unlike Head Start, home visiting, or after school programs, yet there are now more than 3,000 of them working with more than 2 million people annually. So, why are so many public and private funders at the state, county, city, and community levels choosing to invest in FRCs? Simply put, FRCs are just a good idea. They are cost effective, highly adaptable for various communities, be they urban, rural, or ethnic, and have demonstrated successful outcomes through multiple external evaluations. As conveniently located hubs, they bundle and co locate many services that may be familiar to you, such as home visiting, evidence based parenting education, health screenings, play groups, fatherhood programs, family counseling, and food banks. Because FRCs are shaped by and responsive to their communities, we often say if you have seen one FRC, you have seen one FRC. At the same time, despite their organic development, there is remarkable similarity in their most common service areas. The data that you see here on the screen comes from a national study funded by the Robert Wood Johnson Foundation that the NFSN worked with a research institute to conduct. Parenting support exists on a continuum from lighter touch to more intensive services. So, the continuum that you see here on the screen starts with a light touch, that being parenting workshops. As you go through the continuum, you see that the touch for service is heavier. There's parenting support groups to become more engaged and have more direct contact, all the way through parenting education series using evidence based curriculums, and finally going in the home to work with the family during home visiting. Access to resources also exists on a continuum from a lighter touch to more intensive services. So, starting with a light touch being enhanced information and referral, going through to those concrete resource supports, working with families over time to address their family identified goals, and finally, the heaviest touch being the co location of resources. We also see that the other two most common service areas are child development activities and parent leadership development. And FRCs not only provide programs, but build communities of peer support for families to develop social connections that reduce isolation and stress, which are highly correlated with child abuse. Now we are going to hear a testimonial from Sheila Harewood in New York. And let me know in the chat if you cannot hear my sound, but you should be able to.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles. It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax, and it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life. Regardless of anyone's socioeconomic status, regardless of racial background, educational level, the need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
So now that I've described FRCs, I'm going to launch a poll here and ask if you have seen programs that look like FRCs in your state. Let us know here with the poll that we'll launch. So, to your knowledge, does your state have programs that look like family resource centers? Let us know here in the poll. We'll give folks a little chance to respond here, and then we'll take a look at the results. All right, let's take a look here. Okay, so the vast majority of folks in the space, 92%, said yes. To your knowledge, your state does have programs that look like family resource centers. And we have a couple folks that say no and a bit of uncertainty here. So let's take a deeper dive. So, two of the things that families have been seeking support for during the ongoing pandemic and the aftermath of parenting support and access to resources happen to be the bread and butter services of any FRC, be it urban, rural, school based, or community based. So, FRCs more than rolled up their sleeves to help support families during the crisis. These photos illustrate some examples, such as drive by shows of support for families in Kentucky, infant supplies distribution in Colorado, and a virtual bilingual story time in Massachusetts. In Kentucky, the school based FRCs took on delivery of free lunches to students when the schools were closed themselves. States are continuing to invest in FRCs. Some progress that we have seen to date since May of 2022 are investments in FRC network infrastructures in multiple states, including Hawaii, North Carolina, and Texas. There are deeper investments in FRCs in Arizona, Florida, Georgia, Illinois, Indiana, Maryland, New Hampshire, New York State and City, Oklahoma, Utah, and West Virginia. We've had new networks become established and first time investments in FRCs in several states as well. This slide, developed in partnership with Casey Family Programs, which is one of the NFSN's national partners, illustrates how FRCs work with families across the continuum of potential involvement in the child welfare system. Family resource centers have shown that for every dollar invested in family resource centers, the state of Alabama received $4.93 in immediate and long term consequential financial benefits. A University of Chicago study found that neighborhoods with family resource centers had 26% lower rates of child abuse and neglect investigations than similar neighborhoods without them. Teller County, Colorado is a semi rural county outside of Colorado Springs. Since their human services agency moved to a differential response system in 2016, referring screened out families to participate in FRC services on a voluntary basis, they have seen a 63% drop in their child abuse rate, and they only have one FRC in the entire county. Think of not only the huge cost savings, but the human cost savings. So many families that are now spared entry into a highly traumatizing system that no family ever wants anything to do with. And once you're in, you may never get out. The latest data comes from research studies supported by Casey Family Programs that illustrate the specific child welfare system cost savings both in semi rural Teller County and urban Orange County, California. In Colorado, the families who participated in family resource centers demonstrated statistically significant improvements in all of these areas that you see listed in the screen. Kentucky has 981 family resource centers, all of which are school based, and it is the second largest network in the county. They continue to grow, as our notes used to say, 856 and then 888, and now they have grown to over 950 centers. So, what does it cost to run a family resource center? The cost does vary in relation to local cost of living, specific programming, and physical space. For example, a typical community based New Jersey Success Center, again, where they have one in every county, if not more than one in every county, has an annual budget of $240,000 to $300,000 with 3 to 4 full time staff. Now, a school based family resource center in Kentucky has an annual budget of just between 33 to 82,000 with 1 to 2 full-time staff and space and other resources provided in kind. And how are FRCs funded? They are mostly funded by state, county, and municipal governments. Some have leveraged federal funding, such as community based child abuse prevention. And then there are foundations, corporations, individual donors, and in kind support. The FRCs and the Families First Act and how FRCs are included in that is that it's leveraged FRCs to provide up to 12 months of in home parent skill based programs for parents or relatives caring for children who are candidates for foster care. So, in home in this situation means that the child has not been removed from their family, not that the services need to be provided in the home. And FRCs provide programs on the Prevention Services Family First Clearinghouse, such as the Incredible Years, Healthy Families America, motivational interviewing, Parents as Teachers, and Triple P. New Hampshire is the first state to leverage and implement kinship navigator programs and the successful integration of the network of family resource centers to support successful planning and implementation of the Family First Act. So now that we've looked at FRCs, we want to take a look at a level up, and we talk about how family resource centers are coordinated. Not only have cities, counties, and states hit upon the value of FRCs, but they've hit upon the value of networking them together. So, networks consist of two or more family resource centers. The network ensures coordinated quality support to families, as well as serving as a backbone entity to leverage that collective impact of members. Networks can be independent nonprofits coordinated by a public or private funder or led by FRC directors serving as volunteer leadership. Data from a national study that the NFSN worked with a research institute in Colorado on showed that the most common functions of FRC networks are increasing connectedness and collaboration amongst members, providing training and technical support to family resource centers, working on advocacy, policy, and legislation, and providing and maintaining a shared data tracking system. So now we'd like to talk about the three stages of network development. Emerging networks are just getting started, determining who will be at the table and what the focus is. Evolving networks, or when you further develop, you might hire a contractor or your first staff, and the network begins to have more structure and capacity to do more. And established networks are typically when there is staffing and a track record of activities. An interesting characteristic of these networks is that they have weathered crises and decided to stick together. So, again, there are different types of networks. Volunteer coordinated networks are led by FRC directors themselves in voluntary leadership positions without paid network staff. Examples here are New Hampshire, West Virginia, or Florida and Connecticut. There's funder coordinated networks that are led by a public department or foundation that both funds and convenes the centers. Examples here are New York and Nevada. There are nonprofit coordinated networks, and with a nonprofit entity coordinating the network, providing backbone support with dedicated staffing. The nonprofit entity itself is not the network. The nonprofit may incubate the network to spin off in the future, or it may continue to coordinate it. Examples of this are Alaska, North Carolina, and Washington. And then finally, there are independent networks that are staffed through an independent nonprofit organization that functions as a membership alliance with members paying dues. These networks may raise and distribute funds, whether being an intermediary or not. And examples of this exist in Colorado and Maryland. So, a little bit about the National Family Support Network. We were co founded by the 8 state networks of family resource centers that you see currently represented on this map in 2011. For the first 4 years of its existence, the NFSN had no paid staff, and the steering committee members coordinated the work of the NFSN as volunteers on top of their jobs of running state networks. Over the last 14 years at this point, the NFSN has quadrupled in size to now have 42 member networks, 41 states, and the District of Columbia that represent more than 3,000 family resource centers that serve more than 2 million people annually. The newest member is Oregon, that joined earlier this year, and Missouri, which joined so recently that we have not updated to the newest numbers quite yet. They are fresh ink on the paper there. So, the mission of the NFSN is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. The NFSN vision, simply put, is that the entire map that you just saw would be green so that all families will have access to quality family support services in their communities provided by family resource centers, supported by strong networks. There are three main areas of work for the NFSN. First and foremost, connecting and convening member networks to enhance their effectiveness. Second of all, promoting family support best practice and evaluation. And finally, raising the visibility of the value and the impact of FRCs and FRC networks. NFSM membership network criteria are that a network must be two or more family resource center network or family resource centers that are coming together. It could be any stage of network development, and there is one network per state. The dues of NFSM membership cover an entire state, regardless of the number of FRCs. And the membership dues that were just increased this year after staying the same for 3 years are that new member dues are $800 annually for the first year for volunteer coordinated networks and $1,100 for all other types of networks. And then ongoing per year, it's $1,100 for volunteer coordinated networks and $1,500 for all others. Now, the standards of quality for family strengthening and support are core to the work of the NFSN. It is designed to be used by all stakeholders, whether public departments, foundations, community-based organizations, and families, as a tool for planning, providing, and assessing quality practice. The standards uniquely integrate and operationalize the principles of family support practice with the Strengthening Families approach and its research based, evidence informed 5 protective factors. The standards creates a common language for expectations across different kinds of family support and strengthening programs, such as family resource centers, home visiting programs, and child development programs. And the standards help to ensure that families are supported and strengthened through quality practice. The standards are available along with all implementation tools for free on the NFSN website. The standards are organized into 4 areas of practice with 15 standards, each with foundational and high quality indicators and implementation examples. And they focus on 4 core areas of practice: family centeredness, family strengthening, community strengthening, and evaluation. We are proud to report that standard certifications have nearly reached 20,000 individuals certified across the US. The NFSN hosts trainings, and their individual states also host trainings based off of these states that you see highlighted on the map. So, not every NFSN network hosts standards trainings, but these ones do. Now, the NFSN worked with members to develop a blueprint for how to scale family resource centers and FRC networks to ensure that all families have access to quality family support and strengthening services. The NFSN publicly reports back on progress annually with a briefing event in May. Since the beginning, when the idea of starting the NFSN first emerged, the co founders reached out to these organizations and entities that offered their support. This includes the Administration for Children, Youth, and Families, Casey Family Programs, the Center for the Study of Social Policy Strengthening Families, Children's Trust Fund Alliance, Families Canada, Friends, National Resource Center for Community Based Child Abuse Prevention, and Prevent Child Abuse America. These partners regularly participate in NFSN activities, including serving on each other's committees, co-sponsoring events, presenting at events, and working collaboratively on joint projects. The NFSN works collaboratively with many other organizations. We have NFS FRC resources that are available to everyone on the FRC page of the NFSN website. This includes overviews of family resource centers, videos, research reports, and systems level funding information. We also have our Webinar Wednesday library that has topics on family resource centers themselves. So The chances are that if you are interested in a certain topic, such as how family resource centers are co-located with libraries, or how family resource centers specifically serve teen parents, or where there are family resource centers that are co-located with community schools, the chances are that we may have a topic located in our webinar Wednesday library. We also have a network of FRC Learning Hub that is a compilation of resources for those that are looking to develop an individual FRC. We also have the Family Resource Center Network Hub, and that is a compilation of our own templates and documents from member networks that can be used as examples for FRC networks and funders of FRCs. Both of these hubs are completely free to access, and the FRC Learning Hub was developed with the support of Casey Family Programs. The FRC Network Hub is a compilation of both NFSN templates and documents from member networks that can be used as examples for FRC networks and funders of FRCs. There are two sections. There are network tools for FRCs that are samples of tools that networks would use with FRCs, such as identification surveys, evaluation frameworks, and requests for proposals. Now, the network tools for networks are samples of tools that networks would use to run a network, such as member agreements, developing continua, network job descriptions, and operating guidelines. All of these can be accessed at the link that are on the slides. And as a reminder, these slides will be available on the NFSM website along with a recording of this webinar by this time tomorrow. We have member network snapshots for all of our state network members that on our website. And this gives you an idea of the network narrative and gives you quick examples of how many FRCs are in their state network, when it was founded, and how many individuals they serve. The snapshots for every state look different as every state network is unique. NFSN services that relate back to our three core areas of focus include facilitating connections to NFSN member networks. We present for key stakeholders, including education leaders, child welfare leaders, trust funds, and other public and private funders about working with and investing in family resource centers. We provide technical assistance for FRC network development and provide trainings such as the standard certification training, Connect with Effect, which is an outreach training, and Parent Voices Matter. So now we would love to give you about 7 minutes in a buzz session into breakouts. We'll just have you folks randomly paired up in buzz sessions. 7 minutes. We'll give Felipe a moment to be able to open up these breakouts for us. And let me double check that real quick.
Robin, and webinars, we're not able to do breakouts.
Oh, good call. Good call
Yeah.
for today. Sorry, folks. I was incorrect on the facilitation, but what I would love to do is hear from you all and would love to hear what resonates most with you from the information that has been shared today. Let us know in the chat here. Yes, Neil. Yeah, the unique approaches tailored to communities. Absolutely. Family resource centers are community based. They are organically built in communities, by communities, for communities, based off of communities' unique needs. Guidance is effective. Absolutely. Yes, and the breadth of FRC programming, most definitely. Yep, there's many different types of family resource centers. In New Jersey, they're called family success centers, for example. In they're called different things within different states too. Oh, sure, the FRC Learning Hub, absolutely. We've gotten good feedback on that. We continue to develop that as we receive resources. We continue to add to the FRCs, the FRC Learning Hub. And the level of family deep involvement. Absolutely. Families are at the center of everything that we do. Families are intricate to family resource centers, and knowing that we are there to support families in building their strengths that they have determined and supporting their goals is central to our work. And a strong backstory of the first FRCs. Absolutely. Yeah. Good Samaritan House. Most definitely. And always been such an important part of family support. And someone said that they love how many FRCs are out there and how family community focused they are. Most definitely. And being able to see how many states are benefiting from these supports, most definitely, not only benefiting individual families, but family resource centers themselves benefiting from their state being networked together and having that support of that backbone entity to leverage collective impact to strengthen families. And how FRCs have come together in the community we encourage and help build, most definitely. So I would love to also know from you all in the chat, what would you be interested in to explore more? What are your thoughts at your level, whether it be Family Resource Center network? Or maybe you're just getting started. What would you be interested to explore more? Absolutely. Absolutely. So worries for folks I'm seeing in the chat regarding funding, regarding the current political climate and threats to federal funding. Well, one thing that we do know is that FRCs have never had dedicated federal funding. We have recently had an advocacy day where our member networks contributed in the ways that they were able, whether it was just advocating, knowing that FRCs are awesome, even all the way to lobbying itself for family support being written into the federal budget. Oh, yeah. Yep, absolutely. Interested in exploring how funding works. More parent leadership development, most definitely within FRC systems. Rural Oklahoma location resources are sparse, most definitely. Being able to even navigate transportation. And when we talk about the co-location of resources, how that is done when folks do live in rural areas, especially when most of us have states that we have maybe a very large city and then the remainder of the state is heavily rural. And what difficulties have some centers encountered and how they overcame them? Most definitely. And would love to know how to best calculate the return on investment and cost savings of FRC services so you can best report to funders and legislators. I am glad that you all have said these comments, and that really segues really well into my very next slide. But I do want to stick on the chat here. Concerned about how the mindset permeates this. Absolutely. Yep. There is a big threat to funding for family support programs, especially as there's a threat to funding everywhere, and how these changes could discourage federal funder or local donors. Absolutely. Most definitely changes due to the current political climate. So, I would love to let you all know that we are going to have a webinar in September on the return of investment of family resource centers. My colleague Brenda is currently in Kentucky with folks from Washington State, and they're currently presenting on the return of investment for family resource centers. You can register for this webinar on our website. We also do have trainings that are coming up. If you're interested in standard certification, so taking a deeper dive into the standards of quality and how to ensure quality support is happening at your FRC, at your family support program, or across your network, standard certification could be a good fit for you. You can find out more on the standard certification page, and you can also, in the Webinar Wednesday library that I mentioned, there is a standards overview that is completely free. So you can take a look at that webinar, understand the standards better. You can download the standards themselves. You can look at the implementation tools. And if you're interested in receiving certification, this would be the training for you. Now, I saw some folks that had commented on parent leader development and involvement. The Parent Voices Matter, as we call it, the PAC training, Cultivating Resilient Parent Advisory Committees, is the training empowers program staff with strategies and tools to create and strengthen parent advisory committees, fostering meaningful parent engagement and advancing program outcomes, and they are grounded in the national standards. They're rooted in the standards of quality and are adaptable across contexts. They integrate three distinct PAC models from Georgia, Texas, and Wisconsin, making it applicable to diverse demographics and program settings. So, again, rural areas and urban areas. The participants gain a comprehensive understanding of Parent Advisory Committee fundamentals, including identifying key stakeholders, ensuring effective engagement, and implementing actionable steps for success. A unique feature of this training is the opportunity to hear firsthand from a parent leader actively serving on a PAC, providing invaluable real world insights. And participants will learn practical strategies to enhance existing PACs or launch new ones with confidence and clarity. And this training is a valuable opportunity to elevate parent participation and strengthen programs through effective PACs. Join to discover how this training can help your program thrive. We also have a Connect with Effect outreach training that will be offered this summer and this fall. And it really is focused on how essential the outreach to and engagement of families is, again, truly essential for family support and strengthening programs, because our programs are only as effective if they're well utilized. This training explores outreach and planning strategies to maximize program effectiveness with connecting with potential participants, and it is facilitated, it's co-trained by an NFSN staff person and an experienced parent leader who have both successfully developed and implemented outreach plans. We have a resilient leader cohort that will be happening starting in August. It's a 6-week session, and it is really geared towards family support professionals to identify navigating being a leader during these very uncertain times. Uncertainty for funding, as many of you have pointed out, political changes that are affecting everyone across the board, and how we continue to stay resilient, encouraged, and have hope during this time. My contact information is here on the page. We love to hear from you, love to get your feedback. We are ending a little bit early today, so I'm very happy to give you all some time back. I know that we had mentioned Q&A section as well, and I believe that our Zoom functions have changed there. So if we have anything in the Q&A, or if folks have questions, feel free to pop them in there now. You're also welcome to pop them in chat. I have both of them up here on my screen before we move to our next steps. Just reading these last couple of messages here in the chat too. Questions at all today that you'd like to voice? I always say that if you have a question, there's usually somebody else in the room that has it too. How many hours are the 3 trainings and what is the cost? That's a great question, Jerry. So there is a different cost for each one of these trainings, and it also depends if you are coming with a team or not. So please visit the certification training pages to take a look at those specifics. Now, the specifically standard certification is 2 full days, to be able to cover those 4 content areas. The PAC training is also 2-day model, but not quite as long. And then Connect with Effect is just one day. So these are the trainings that have a cost associated with them, as well as the Resilient Leader. That is just one cost for the 6-week cohort. That's a great question. And it also may differ because your state, in addition to the NFSN standards trainings, your state may have additional dates as well, but they'll always be that 2-day model. Other questions on anything related to the NFSN, on family resource centers networks, things that you're excited to take back to your programs, things that you're excited to see happening in your state? Well, folks, I want to remind you that after the session closes, just to ask you all to please take a few minutes to fill out the evaluation that will automatically pop up on your screen. It has questions about identifying your next steps, and we would love to support you with that. And I do see something that popped up in the chat here too. Share some ideas on how we've built community at my local FRC. That is a great Absolutely. So again, I'm at the national level now. When I was at my Family Resource Center in Milwaukee, Wisconsin, some of the ways that we were building community, one thing that immediately comes to mind is we had a need in our community for a connection with the fire department in terms of the calls that they were responding to. And the fire department and talked to the city and said they didn't know where to go. Where can they talk to families? And we said, us. You can talk to families through us. We're a family resource center. So the firefighters came out. They had conversations. It was a lot about medication use, and again, based off of what was happening in our community and in our city, and also starting to bridge that relationship with first responders, especially, and community members that are calling out the fire department. So that is one example that comes to mind for sure. Would also love to direct you to the webinars because my specific experience is one small drop in the bucket of the representation of more than 3,000 programs nationwide. The leadership training is not on the website. Is it somewhere else? The leadership training would be on the very first page on the website, on the homepage for you. And if you wanted to find a list of all FRCs, that is an awesome question. So that data typically does not exist. Most programs and most networks would love to have a database of all of their FRCs, and some do, but it isn't something that we maintain nationally, especially just with the transitions and things like that. So if you want to look at family resource centers across your state, the best way to start would be going to that snapshot based off of your state. Click on your state on the NFSM website, click on the snapshot, and then see if that state network has a website. For Wisconsin, for example, the state that I live in, there is a map of all the family resource centers that are connected in with the network. So Wisconsin, for example, does have that. Now, there could also be, if you're in a really small state, for example, or a network that is just getting started, like Wyoming, for example, and Oregon is also just getting started, and Missouri, those states might just have a contact information, and you could reach out to those FRC network directors, introduce yourself, and let them know what it is that you're trying to look for. And a lot of FRCs are on Facebook, most definitely. Standards Overview webinar is not on the Webinar Wednesday page. Go all the way down under Core Webinars, and you'll see three. You'll see Developing Networks, you'll see Uncovering Family Resource Center, America's Best Kept Secret, and then you should see Standards Overview as well, all the way down on the Webinar Wednesday page. And there is an FRC network in Nevada. They have had transitions in the last couple of years, but moving to Nevada, if you are looking at starting a family resource center, I would definitely direct you to the FRC Learning Hub as well, which is intended for folks that are looking to start individual FRCs. Your organization is branching off to the FRC road. How do you identify? That's a needs assessment. 100%. That is a great question. And what we would suggest is that you start with a needs assessment of your community. If you visit that FRC Learning Hub, take a look for community needs assessments, and you can see examples of what other states have done in their community, and you can tailor it to fit the needs of your community. You could always start with that as a basis and then customize it. I just want to double check that I have responded to all of these questions. These are awesome questions. So thankful for your engaged participation today, folks. Okay, awesome. Awesome. Yes, we are really excited about the return of investment on FRC's webinar. It is so easy to present. It's so great to show what the return on investment is. And that is just the dollar savings that we show to folks. But all of us who are working as well on the ground with families understand that the human cost savings is something that is invaluable. Nevada. I would take a look at our website, Lisa. You can also, for Nevada, you can also leave your contact information in the evaluation and we can connect you directly. Nevada did used to run it through their Health and Human Services department. And I know that they have had some transition, which happens a lot with networks, but the work continues. So feel free to take a look at the website or let us know in your evaluation. We'll connect you with the good folks out there. The Resilient Leader training is going to be on the homepage of the NFSN website. And who decides which schools obtain FRCs on site? That would depend on the network. So, for example, in Kentucky, their network is built into their state statute for education. So it builds that way. It depends on who runs the network. It might be volunteer led, it might be state led, so they might hand out contracts. A good place to look for that would be the network hub to see about specifically you could look at requests for proposals, RFPs. I know that New Hampshire just went through a process where they were giving out RFPs for their state network. And then I know that Washington, D.C. has also done requests for proposals for individual network or for individual FRCs themselves. Most definitely. And Jessica, there is a really great webinar on FRCs with community schools that you might really enjoy. It's different than just a completely school-based model, but a lot of states have community schools as well. So that's a great resource, especially. And the one for teen parents too would be great just because they're oftentimes so school-based. So my contact information, you all have it on these slides, which will be available tomorrow. I'm also on our website as well. As you all are looking at these specific questions, or if you're looking at navigating these resources and you want to touch base, please reach out to us. We'd love to hear from you all. So again, friendly reminder to please take that evaluation. We sincerely consider all of the feedback that we use and we incorporate it for all of our webinars. So our time today here is ending. Thank you all so much for your engaged participation, and we will see you next time.